Lincoln Community Health Center has a proud and rich history in the Durham community, tracing its origins to the original Lincoln Hospital, established in 1901. Before Lincoln Hospital closed in 1976, Dr. Charles Watts and others opened a community health center to provide medical care to the poor. Today, Lincoln has proudly served Durham since 1971, providing comprehensive primary and preventive health care services to almost 40,000 patients annually.
I grew up in the Durham community, actually right down the street from Lincoln Hospital and then Lincoln Community Health Center. It was just a vital part of Durham. We had nowhere else to go, I think, that could provide the quality care that the African American community needed. Lincoln Hospital is our hospital in the Durham community.
The mission of Lincoln Community Health Center is to serve our most medically vulnerable populations. And in the early years, more than 80% of Lincoln's patients were uninsured. Although today more people have some type of insurance or pay for services based on a sliding fee scale, it's always a struggle to financially survive while providing quality health care to the uninsured and underinsured.
I can think of a patient whom I saw recently who actually lived in the surrounding county who was uninsured, lots of stress in her home, and lots of bills and really no income, and lots of chronic medical conditions.
In 2008, under the leadership of Joyce Nichols, the Lincoln Community Health Center Foundation was incorporated as the fundraising arm of Lincoln. The foundation is needed because Lincoln's resources alone are not enough to serve a high proportion of low-income and uninsured patients. The foundation raises money from the community so that Lincoln can continue to meet the healthcare needs of Durham citizens. The foundation has helped pay for needed supplies, equipment, and other patient services.
There's a great need because we know that the health care is very expensive. So the foundation is clearly a vision that Joyce Nichols had, and for that, we're just eternally grateful. We not only want the center to be important to survive, we want it to thrive.
The Community Health Center model is built heavily on partnerships and collaborations. Lincoln cannot maintain services alone without support from other providers and resources. Community health centers save cost by getting the uninsured and underserved into a medical home so that they can receive the appropriate level of service at appropriate times and by the appropriate providers. The focus is not only on access to care, but also quality of care.
What's important to Durham? Lincoln tries to care for anyone who needs or wants care, and I want to be a part of that in every way. So I feel like it's important for me to contribute, and I do.
Today, Lincoln provides an array of primary and preventive health care services for populations that often go unserved. This includes patients who are low income, HIV positive, recovering from substance abuse, homeless, and a growing refugee population. Lincoln serves children and adults who often have nowhere else to turn for their medical care.
I consider Lincoln as a real blessed. When I moved from Jersey to North Carolina, I don't have a health insurance, and I choose Lincoln. But I still be patient of Lincoln because the quality of service, and I can afford that, and I have, in my opinion, the best doctor in North Carolina service to me and my family.
We are in uncertain times, and funding for community health centers can be unpredictable. We'll continue to need financial assistance from the broader Durham community to ensure all our citizens have access to high-quality medical care. These are your neighbors, friends, and co-workers. The Foundation welcomes financial support from business, private philanthropy, and the general public. We invite you to join us as we strive to provide quality health care for all.